And there are estimates that in the richest country in the history of the world, some 60,000 Americans die every single year because by the time they walk into a doctor's office, it is too late.
Insured is because they have $6,000 deductibles. As a doctor, I know that was a barrier to care. That is the status quo. We can change that status quo for next year.
So for the drug companies and the insurance companies, system is working really great, and that is what it is designed to do. Unfortunately, for the rest of the American people,
Welcome back. In this intense Senate hearing, we see the absolute core conflict over American healthcare. Senator Bernie Sanders and Dr. Fagen are not just criticizing the system, they're accusing it of being structurally cruel and lethal. Sanders dropped the shocking statistic that 60,000 Americans die every year simply because they can't afford to see a doctor in time. Senator Cassidy and Dr. Fagen immediately lock horns over what the real barrier is. Is it the system itself, or is it those crippling $6,000 deductibles? This debate is the whole fight for the future of American health. Let's get into the details.
it means unbelievably, Mr. Chairman, as a nation, we are spending $15,000 per person today on health care, adding everything together. Family of four, $60,000. So if you're spending $15,000 per person, you must be getting the best healthcare system in the entire world, right? Everybody in America has high-quality healthcare. Go to any doctor they want, low-cost prescription drugs, because we're spending twice as much per capita. Well, not quite the case. The reality is that despite spending $15,000 per person, we got 85 million Americans who are uninsured or underinsured. What does that mean, Mr. Chairman? It means that if you are underinsured or underinsured and you get sick, you don't go to the doctor. And you know what happens when you don't go to the doctor when you get sick?
Sanders sets the emotional floor of the debate. He's arguing that the massive spending doesn't result in better health, it results in death. When he mentions the $60,000 family cost, he's instantly connecting with middle-class viewers who feel the financial crunch. The 60,000 preventable deaths is his biggest weapon, turning a policy debate into a moral indictment. This clip is designed to establish the human cost of the current system.
Sentiment about wanting to do something quickly. And the reason for this hearing, to be frank, is that my Republican friends understand they got a political problem. And what is their political problem? The political problem is that all over America today, people on the Affordable Care Act are opening up packages coming from the insurance companies, and guess what? Their premiums on average are doubling, in some cases in my state, tripling or quadrupling.
Here, Sanders is playing political strategist. He's taking the high moral ground and simultaneously exposing the GOP's perceived vulnerability, the rising cost of health insurance. He claims this isn't about fixing the system, it's about political damage control because voters are seeing their bills double. This frames the GOP's proposed solutions as temporary fixes, not substantive change.
The current American healthcare system. So what should we do? Well, common sense would suggest, okay, you got a broken system. But you and I think, agree, you don't want to see people seeing a doubling in their premiums. So let us extend the current ACA tax credits for at least another year, 2 years, 3 years, while in fact, and I'd love to work with you on this, in this committee we tackle the real issues. And by the way, if we're going to tackle the real issues, the first thing I think that we should do, Mr. Chairman, and I mean this very honestly, is have a panel with people from different countries around the world who are, A, providing health care to all of their people as a human right, and we are the only major country on earth that does not do that, and say to the people in France, in Japan, how do you manage to provide quality care to all of your people at half the cost that we do in the United States? What can we learn from other countries? I think that would be the first approach, and we can argue from there. But anyhow, I think the immediate task is to, as bad as the current system is, we don't want to see a doubling, tripling of premiums. We got to extend those, and then let's sit down and develop a system that works for the American people, not the insurance companies, not the drug companies. In my view, in Dr. Fagen's view, the answer is, in fact, going to be to emulate what many other countries do, guarantee health care to all people by extending Medicare in this country, Medicare for all.
This is Sanders' tactical move. He offers a peace offering, extending tax credits, which gives him common ground, but only as a bridge to his ultimate goal. His challenge to study France and Japan is brilliant. How do you provide quality care to everyone at half the cost? It forces the opposition to defend American exceptionalism in spending rather than in results.
The reason people are uninsured is because it has $6,000 deductibles. As a doctor, I know that was a barrier to care. That is the status quo. We can change that status quo for next year.
Can you
I
change?
don't want people to be underinsured.
All right, can you change that status quo and make sure with you like every other country does and guarantee healthcare to all people with virtually no out-of-pocket expense?
So if there's going to be a big idea, that will not happen by January 1,
Right.
2026. It is something we can consider for 2027 or beyond. But I'm focused on 2026 because that's where the immediate need is.
And if that's what we're going to do, let's extend tax credits, and then let's have that discussion.
So people remain underinsured.
This segment gets to the root of the underinsured problem. Dr. Fagen refines the issue. It's not just the uninsured, it's the deductibles that stop people from seeking treatment.
Your program is not going to guarantee health insurance to all people.
We will not accept that. With
We
that,
will not accept the doubling of premiums.
good. Then maybe we can have common ground. That's the common ground. Let's proceed.
Senator Sanders and Dr. Fagen are making the moral case. The system is a cruel failure because 60,000 people die preventably every year, and 85 million people are left vulnerable. Their goal is radical systemic change, Medicare-for-All, because they believe the system's primary function is profit, not public health. Sanders is trying to force his opponents to answer one question. How do you justify a system that costs twice as much as every other wealthy nation, yet delivers worse health outcomes, lower life expectancy, and crippling deductibles? I want to hear from you. Dr. Fagen claims the $6,000 deductible is the real barrier to care for millions of Americans. Do you agree that high deductibles and copays are the biggest problem in American healthcare right now, or is the lack of universal coverage the primary flaw? And if you had to choose an immediate path forward, would you prioritize the long-term comprehensive change of a single-payer system or a short-term market-based fix to stop the premium spikes? Let us know your thoughts in the comments below.